Hey, what's up? How you doing? So today had a couple of conversations with people about rationing care from a medical standpoint. A lot of times people think this means when you are in a situation such as we are with COVID that you can't take care of everybody. So it sounds really sensational. It sounds like, okay, grandma comes to the hospital, we're not going to have beds to take care of grandma, so we just leave her outside in the cold. That's really not what's happening in the United States right now. Is that possible with an increase in the number of COVID patients? Absolutely. But we're not there. What's happening now is something like at my hospital. We have a situation where we've had to close down elective surgery. What that means is if you walk into my office right now and you said, hey, Dr. Crawford, I need my gallbladder taken out, then I would have to say, hey, we may have to wait a week or two. Now, during that time, we would still give you antibiotics. Is that the perfect arrangement? No. Ideally, I would want to take your gallbladder out as soon as we have it diagnosed as being problematic. But we can't do that all the time. That also means that a cancer patient, say you're diagnosed with colon cancer because of rectal bleeding, that patient now has to wait 2 or 3 weeks to have surgery as opposed to having it the next day or the day or a week after it's diagnosed. Is that going to change the patient's stage? Probably not. We have pretty good data to suggest that waiting 2 to 3 months for a cancer operation may not change someone's stage. Now, again, that doesn't take into account all types of cancers. The same is also true for disease involving peripheral vascular stuff. So whether or not you have claudication of the leg, whether you have a heart attack, whether you have carotid artery disease, those treatments that would be normally considered urgent are now pushed back so that we can make room for COVID patients. So this is what we're talking about when we talk about rationing care. Now, to the extreme, does there remain the possibility that we don't have enough beds in the hospital to take care of people at all? Yes, that is a real possibility. And I think that's the main reason that a lot of healthcare providers are focusing on getting people to social distance, not to gather, to wear masks, and kind of be conscious about your exposure to people. When you're diagnosed with being positive, make sure that you quarantine. Make sure that if you have a family member that is positive, you're practicing some of the outpatient treatment guidelines laid out by the CDC. This type of behavior may be the difference between someone with asthma or someone with morbid obesity or someone with congestive heart failure staying out of the hospital and keeping their O2 saturations to a level that they don't require ICU admission versus them coming to the hospital and requiring an ICU admission. Give me the option of, if I can't keep you home, I would at least like to keep you well enough to where we can keep you on a regular floor bed. If that's not possible and you have to go to the ICU, then that's fine. But that's what we need from a patient care standpoint or a self-care standpoint so that you can help us take care of you. When do we see this getting better? Nobody knows. Right now, we were supposed to have about 20 million people vaccinated in the United States, and we've only done about 2.7. So we're way behind where we need to be, and we right now don't have a obvious effective rollout plan. I think people thought that as soon as we got the vaccine, then we were good to go. And a lot of times people forget that it's not just having the vaccine. There are a couple of steps that have to be done. One of them is getting the vaccine to people. Another one is figuring out who gets the vaccine first. Another one is storing the vaccine. Another is deciding whether we're going to try and bring the patients to us to vaccinate or we're going to the patients to vaccinate. Another issue that hasn't been addressed yet is whether or not the people giving the vaccine, whether or not they're trained to do it, and whether they are given the correct support to be able to give the vaccine. Both of these vaccines have to be thawed, which means that there's a process that has to go on before the patient gets the vaccine. Are those processes in place, or are they just kind of like, okay, here's the vaccine, do what we can? So there's a lot that goes into it, and we have to come up with a better delivery system and a better way to do this so that we can get a significant number of the United States population immunized against the vaccine. Hope this answers a lot of questions. Good luck. Stay safe.